In this session, we will introduce you to the ultrasound machine. We'll explain how it works and how to use it. The main questions we will answer in this lesson are: what produces the image that we see? How do we use ultrasound to identify different structures, such as fetal organs, amniotic fluid, and bones? How can we use the controls on the machine to improve our image? And is ultrasound harmful? Sound is simply a series of vibrations or waves that travel through the air and can be heard once they reach the ear. When these waves are very tight, meaning that they vibrate at a high frequency, or are far apart, vibrating at a low frequency, humans cannot hear the sound. The process to create an ultrasound image is fairly simple. First, the transducer produces high-frequency sound waves that the human ear cannot hear. Those sound waves travel through the body and bounce off different tissues. In this diagram, the transducer is on the left and the patient is on the right. The red lines represent the sound waves sent into the body by the transducer. The green lines are the reflected sound waves that return to the transducer from the body. These reflected waves are called echoes. The reflected echoes go back to the transducer, and the computer analyzes these waves and builds an image. On the left is an image of a midwife learning to perform an ultrasound on a pregnant patient. The transducer is in her right hand. The cable connecting the transducer to the computer is draped around her neck. The image on the right is what is seen on the screen. Notice the many different shades of gray in the image of the fetus. We see black, white, and shades of gray on ultrasound because the sound waves react differently to different tissues and fluids. For example, sound waves tend to pass through fluids without reflecting back to the transducer. This means that fluid tends to produce no echoes. In contrast, sound waves cannot penetrate bone or air, so they are reflected back strongly and produce strong echoes. Soft tissues are somewhere in the middle. Some sound waves pass through and some reflect back. This is a second trimester fetus, placenta, and amniotic fluid. Sound waves pass through the amniotic fluid without reflecting back, so amniotic fluid appears black. The skull is white because most of the sound is reflected back. The placenta is soft tissue, so some of the sound passes through and some reflects back. This is why it looks gray. The fetal abdomen is also gray because it is soft tissue. The term echogenicity refers to the brightness or whiteness of the echoes compared to the echoes that surround it. In other words, it describes the strength of returning echoes. Echogenic is a term used to describe any structure with echoes. There are 4 levels of echogenicity, or strength of the echo. Hyper means over or above. So hyperechoic means a very strong echo, which will appear brighter than surrounding echoes, usually white or light gray. The prefix "an" means none. Anechoic structures appear black because they do not reflect sound waves. Isoechoic and hypoechoic are shades of gray between the white hyperechoic and the black anechoic. We will discuss these terms more in the hands-on sessions. In this image, the amniotic fluid is anechoic and the skull is hyperechoic. What does that tell us about the echoes in these 2 areas? This means that there are no echoes from the fluid, and there are strong echoes coming from the bone in the skull. Bone and air are the most echogenic. They are hyperechoic and will appear white. Fluids, including blood, amniotic fluid, and urine in the bladder, are anechoic and will appear black. Soft tissue will appear either isoechoic or hypoechoic, as you will see in the hands-on sessions. These are different views of the fetus. What color are the hyperechoic structures? Hyperechoic structures are white. In these images, they are the skull and femur. If something is anechoic, what does that mean? What color will it look like? Anechoic means there is no echo, so it will appear black. In these two images, the anechoic structures are the bladder, which is fluid-filled. Other structures that should be noted here include the hyperechoic fetal spine on the left and the hypoechoic or gray-colored placenta on the left and the uterus and cervix on the right. There is another set of terms we use to describe tissues seen by ultrasound. In these images, we can clearly see three different types of tissue. Tissues are described as cystic, solid, or complex. The left image is an ovarian cyst. The middle image is a fetal abdomen, which appears solid. The right image shows complex tissue, which is an ovarian cyst that is bleeding or hemorrhagic. We will now look at each type of tissue more closely. A cystic structure is filled with fluid, and its walls are generally smooth. Because a cyst is fluid, it will be anechoic. These are both images of ovarian cysts. Unlike cystic tissue, solid tissue has no fluid. Therefore, it will reflect some echoes. While cystic tissue will appear black, solid tissue will appear gray or white. The left image shows the fetal abdomen, and the right image shows a placenta. Both are shades of gray or white. Please also notice the fetal arms in the image to the right. The red lines trace the arms from the shoulder to the hands. Tissue that is complex has both solid and cystic elements. The left image shows an ovarian cyst with bleeding inside that appears complex because there's a mixture of fluid, which appears black, with clot that appears gray. Compare this with the anechoic bladder that appears completely black next to it. The right image shows a uterus without a pregnancy. Notice that there is complex tissue behind the uterus that appears mostly gray and white, but also contains some black within it. The complex tissue collection is outlined here to make it clearer and is not normal. This is actually hemorrhage, a collection of blood clot and fluid behind the uterus from a ruptured ectopic pregnancy. Now we will get acquainted with the ultrasound machine. Please pause the video to distribute the ultrasound machines among participants at this time. There are many controls and buttons on the machine that help us change the way images look. We will learn how to adjust these controls to get the best images. This is why it is important to understand how ultrasound works and to learn where these controls are on the machine that you will use. Understanding how ultrasound works will help you decide how to make adjustments using these controls to achieve a better image. Don't feel nervous about seeing so many buttons right now. Although there are many controls you can use to improve your image, there are 5 key functions you will use in every scan. For the ultrasound trainers, please face your demo machine towards the participants so they can clearly see these controls. Please locate each of these controls: overall gain, time gain compensation or TGC, depth, zoom, and focus. Now we will learn about each of these controls. The first control is the overall gain. It is the large round control on the lower left corner of the machine pictured in the video. Where the gain and other knobs are located often vary between ultrasound machines. Please locate where the gain button is on your machine.